Hello, everyone. Our next speaker and our last talk of the day will be given by Dr. Riley Johnson, who is a neurology pharmacist trainee at the VA West LA location.
Hello, everyone. Thank you so much for the great introduction. It's a great privilege to get to present at the Epilepsy Awareness and Education Expo this year. Today, I will be presenting on the newer anti-seizure medications. Before I get started, I just want to say that I don't have any financial or personal ties to any of the companies that I'll be presenting on their medications, but they do offer some great educational info on all of their websites if anyone is interested. So we'll go ahead and get started here with our first medication, Finfluramine or Fintepla. Finfluramine is an FDA-approved medication for Dravet syndrome. It was originally used back in the 1970s prior to being removed from the market, and recently actually got reapproved for the safe and effective use of in treating Dravet syndrome in patients who are 2 years and older. This medication can be used for other things that your neurologist deems appropriate, but its FDA-approved indication is for Dravet syndrome. It currently comes in an oral solution that's 2.2 milligrams per mil. It's appropriately weight-based dosed, and those doses are going to be divided out into 2 equal doses throughout the day, usually administered about 12 hours apart. And when you think about taking Finfluramine, there are a couple of restrictions to think about. It has a REMS program. The REMS program is for its increased risk of valvular heart disease and pulmonary arterial hypertension, but it is also a Schedule IV controlled medication in the United States. When it comes to some of the dosing specifics, there are a couple of drug interactions to think about. Finfluramine is frequently given alongside of both Steripental, which I'll talk about later on, and Clobazam. When given with these two medications, the Finfluramine dose will have to be reduced, and your doctor will appropriately do so if needed. When we think about keeping Finfluramine in the home, there are a couple things to think about. Make sure it's kept at room temperature, store it away from light or moisture as best as possible. So keep it out of the bathroom, try to keep it on a higher shelf to keep it away from children as well. And if by some chance you happen to miss a dose of Finfluramine, it's best to take it as soon as you can remember. But if you don't remember relatively close to the actual dosing window, the next best bet is to call your healthcare provider and ask for specific advice, as they may have a different way of making up for a missed dose. And this is a recommendation from their package insert as well. When we think about how well Finfluramine works, their initial trial showed that Finfluramine reduces the number of seizures at the higher 0.7 milligram per kilo per day dose compared to placebo by about, it actually has over a 14-week period reduced the number of seizures to between 0 and 1 in about a quarter of the patients that are taking it. For about 25% of the patients that are taking it. When we look at its overall reduction versus a placebo, when you see a 50% reduction in about 50% of your patients, although it was a relatively small trial, this is a pretty effective medication in comparison to a placebo. And it did show some even more beneficial results with even a 75% reduction in about 40% of patients. These results do not apply to every patient. It's not something that's widely applicable, so always consult with a medical provider before interpreting these results. When we talk about who can't take Finfluramine, there are a couple of specific patient populations that we want to try to avoid giving this medication to, specifically patients who have heart valve conditions or anybody who has an increased level of pressure within their arteries in their lungs, or also known as pulmonary hypertension. In patients who have fluctuating kidney and liver function, if those decrease over time, Finfluramine is also contraindicated for use in low kidney and liver function. When you're taking fenfluramine, overall, you will need to monitor quite a few things, including an echocardiogram, which is a part of their black box warning. You'll need to get an echo before you start taking fenfluramine, every 6 months during fenfluramine treatment, and approximately 3 to 6 months after you are done taking fenfluramine, you'll have to have a follow-up echo. When we look at other things to look at, weight and growth in pediatric patients is going to be a really big thing to look at, because fenfluramine can actually decrease the appetite and it will cause a decrease in weight as well. Blood pressure is also something that needs to be monitored on a regular basis. This isn't necessarily something that needs to be done every day, but on a regular basis based on how your medical provider tells you. You'll also need to monitor mental status and liver and kidney function regularly as well. When we look at the actual side effects that come along with fenfluramine, some of the more common things that we can see are both diarrhea or constipation. The respiratory infection rates have been shown to be a little higher in the fenfluramine groups. There's also an increase in drooling and problems with movement, balance, and walking, as well as falls and seizures that do not stop. All of these things are just a little bit more common than some of the more serious ones here, like the decrease in appetite and weight, which is something that we try to monitor for. The other things that we try to monitor for specifically are things like suicidal thoughts and actions. All anti-seizure medications come with this as a risk factor, but it's something to keep in mind whenever taking a new medication, is to always watch the general mood that you're going to have while taking it. It also has been shown to cause increased sleepiness, sedation, and lack of energy in a lot of patients that have taken it. Higher body temperatures and tight muscles are also potential problems. And then we've already talked a little bit about why it got its black box warning, with increased hypertension in the arteries of the lungs, as well as problems with the heart valves. Some common questions that come along with fenfluramine: can fenfluramine be used with CBD? Any commercially available CBD you can utilize fenfluramine with, and there are no dose adjustments required. Fenfluramine also can be utilized in a ketogenic diet. It does not contain any type of gluten inside of its formulation. Moving on to our next medication, we're going to be looking at Briviact, or Brevacetam. A lot of people might call this drug kind of like the cousin of levetiracetam or Keppra. It's a medication that has a fairly wide usage. It can be used in patients with partial onset seizures at 1 month of age and older. Any other seizure disorder that your doctor deems appropriate, brivaracetam can also be used at. It comes in a variety of different dosage forms, including an injectable solution, tablets, and an oral solution that can be utilized as well. The oral solution is a 10 milligram per mil, so very easy to dose at home, especially if you're giving it to children based on a weight-based dose, which is what is recommended in your patients who are 50 kilos or less. And those doses are calculated out over an entire day. And once the dose has been calculated, it's usually divided up into 2 equal doses given about 12 hours apart. Same goes for adults. Our usual dosage goes between 50 milligrams and 100 milligrams. And we try to do that twice a day as well, because we have kind of about a 12-hour half-life on this medication. So we want to try to keep that drug level up in the body when we have our half-lives about that long. When we look at brivaracetam storage, it's fairly similar to fenfluramines, where we want to keep it at room temperature, store it away from light and moisture as much as possible, and keep it up on kind of a higher shelf to stay out of children's reach. Things to remember: if you ever miss a dose of brivaracetam, take it as soon as you possibly remember. But if it is too close to the next dose, they recommend taking just the next dose and never take 2 of these doses at the same time. You don't want to double up and stack your doses. You just want to take it at the next available dosing time. When we look at the effectiveness of brivaracetam, brivaracetam did show fairly positive results within their study. If you look at graph B there, that's its placebo-controlled, looking at how many of its responders, how many of the people who took it they would define as responders. It showed that it had about a 38% response rate in comparison to the 21% that placebo had. So very good response rate in comparison. It's it is much better than placebo. When we look at its reduction in 28-day frequency of seizures, there was a pretty significant reduction there as well, with about a quarter reduction in patients taking both 100 milligrams and 200 milligrams a day. Thinking about the restrictions that come along with Brevacetam, this medication is also a Schedule IV controlled substance in the United States. There are a few requirements for monitoring it, including getting regular blood work drawn to check liver and kidney function, as those can be things that need to be adjusted for. It does interact with a few medications and may require some dose adjustments from your doctors, including rifampin, carbamazepine, and phenytoin, which are all common medications that may need to have their doses reduced if used with Brevacetam. And then when we think about people who can't take Brevacetam, the only group that we recommend not taking Brevacetam in, if it were appropriate, would be a pregnant patient. This medication is a teratogen. When we look at the side effects of Brevacetam, by far and away, the largest side effect that they showed was somnolence and lethargy, with about a quarter of the patients in their trials having this kind of response to taking Brevacetam. The other thing to think about, like I said, all anti-seizure medications come with the risk of suicidal behavior and ideation potential. Brevacetam comes with both new onset and worsening depression potentials. It also comes with the risk of having increased dizziness, disturbed walking and coordination, as well as psychiatric disturbances, nausea and vomiting. And anytime that you consider stopping any anti-seizure medication, always do so with a doctor's consent. But they will go through and do that very, very slowly. As coming off of Brevacetam, we want to do any kind of reduction in seizure medications very slowly. Coming up on our next medication, we're going to talk a little bit about Steripental. Steripental can be used in combination with clobazam for the treatment of Dravet syndrome in patients who are 2 years and older. It does have to be utilized with clobazam, although it does actually have a drug interaction with clobazam that we'll get to in a minute. Steripental comes in a variety of different dosage forms, including a capsule and a powder that you can place into an oral solution. They do recommend mixing it with water. An appropriate dose of Steripental. This medication is again calculated based on a patient's weight and divided up into between 2 and 3 doses per day, depending on what your prescriber decides. When we talk about missing doses of Steripental, this one again, take the dose as soon as possible. If you don't get it on time and it's almost time for the next dose, make sure to call your healthcare provider to get their specific advice on that. This medication isn't one of the ones where we would consider, this medication just may have some specific considerations that we might want to consider. You would want to consult a doctor prior to skipping this medication or not taking it. And then when it comes to how you store it, you want to make sure that you're storing this medication, again, very similarly to our other medications. Store it out of light and moisture, keep it at about room temperature as long as it's below 86 degrees Fahrenheit. But we also want to keep it out of the reach of children. When we look at our effectiveness of Steripental, we had 2 different things that they looked at in their trial as far as their primary response rate. Their primary endpoint here at the very beginning, they defined percent responders as having a greater than 50% reduction in seizure frequency. So they showed that about 70% of their patients, in comparison to about 7 with a placebo, had a greater than 50% reduction in seizure frequency. That's some very high numbers, but again, we always want to consult our doctor before we get too far up on these results, because some of these results may not specifically apply to each individual patient. When we look at seizure-free response, they also had a very high response rate at about 36% as compared to 0% with placebo. Their trial was a little bit smaller at about 64 patients, but these are some pretty positive results when it comes to treating Dravet syndrome. When we look at the side effects that come with Steripental, again, Steripental and clobazam, both of which can cause some fairly bad somnolence. When they're dosed together, they do require a dose reduction. When I talked about having that potential drug interaction, this is where we kind of get around that drug interaction by reducing our clobazam dosing. When we initially start doing Steripental, we like to reduce by about 25%. If somnolence continues and it's a constant report, we like to reduce that by another 25% to make sure that we're not over sedating on these medications. The next thing to really pay attention to are decreases in weight and appetite. This medication can also cause this very similarly to our first Finfluramine that we talked about. It can also cause increases in agitation, and very similarly to a lot of anti-seizure medications can cause some difficulties in coordination, balance, and speech. And then, like I've talked about with all our other medications, increase in suicidal thoughts and behavior are always a potential with all anti-seizure medications. This medication does come with a specific side effect of having decreased white blood cells and platelet counts, which does require some regular monitoring on top of just normal follow-ups with your doctor. So who can't take or are there any kind of restrictions that come along with Steripental? Currently, there are not any. It is not a controlled substance. And there are a few different types of monitoring requirements, including regular blood draws, and then once every 6 months or so right after starting this medication. And then are there any kind of reactions with Steripental? Steripental actually has quite a few interactions with a lot of seizure medications, so it's always a good idea to have your doctor check in on all of the other medications you're taking and always keep every doctor up to date on your entire list. But clobazam, like we talked about, is one of the specific instances that Steripental has an interaction with, and it does usually require a dose reduction, which your doctor would take care of. And then our final medication is Synovimate. This medication is utilized to treat focal onset seizures in patients who are 18 years or older. It is fairly recent. Back in 2021, it was approved. For any other seizure disorder that your doctor deems appropriate, Synovimate may be a potential, but always consult a doctor before attempting to start any of these medications. And then Synovimate is supplied in oral tablets. And then as you can see in the picture right next to it, they do come in tablet therapy packs, which kind of help titrate up on dosing. And then what is the appropriate dose of Synovimate? This is another medication where we kind of start with a preset titration, starting at 12.5 milligrams, and then you can just continue to go up as long as there aren't side effects until you hit a max of 400 milligrams. And that would be decided entirely by your doctor and how well you're responding to this medication. Synovimate, again, we need to store it at about room temperature, keep it out of the reach of children. And then also when it comes to missing doses of Synovimate, this is fairly consistent across most of our medications we've talked about. Take it as soon as you remember. If you happen to be too close to the next dose of medications, skip the prior dose and return to your normal schedule. Never double up on this medication. When we look at the effectiveness of Synovimate in comparison to a placebo in its phase 2 trial, it had an 18-week double-blind period with a seizure reduction of approximately 55% in both the 200 and 400 milligram per day groups, in comparison to about a 24% reduction, which happened in our placebo group. When we look at specifically how Synovimate broke it down by percent reduction, greater than 50%, they had about 64% of patients hit that in their 400 milligram group, as compared to 25 in their placebo. And then they had a seizure frequency of absolutely 0% in 21% of their total population at the highest dose possible. But again, the response that you will have to a medication may differ significantly from the responses that are seen in these studies. So always make sure that your doctor takes into account all of the side effects that can potentially happen. When we think about the side effects that can happen with Synovimate, the really big ones that are related to the dose and maybe are reason why we don't continue to go up on a medication include the somnolence, dizziness, fatigue, double vision, and headache. All of these can get potentially worse the higher the doses get. So that's why we would want to continue to stop. We would not want to continue to titrate this medication to its highest dose. And like I talked about already, all anti-seizure medications come with this increased suicidal behavior and ideation risk. And it is contraindicated in patients who have a familial heartbeat irregularity, also known as an arrhythmia. Are there any kind of restrictions on top of Synovimate? Synovimate is a Schedule 5 controlled substance, so there is some restriction along with it. And are there any kind of monitoring requirements? Synovimate does have some liver function that needs to be monitored for. You also have to monitor for potassium levels. Any kind of medication related rash, you would need to let your doctor know immediately, as this can be potentially life-threatening. And also make sure that you always monitor mental status, as these medications can definitely cause a little bit of sedation. So it's good to always monitor that, as well as monitoring for mood with a lot of the suicidal thoughts and actions. When it comes to interactions with medications, Synovimate again does have a fairly significant list of anti-seizure medications that it does interact with, quite a few of which do require dose reductions, including things like phenytoin and phenobarbital and clobazam. And that's not an all-inclusive list. There are quite a few beyond that that would require an adjustment in one of these medications. I really appreciate everyone's time today. Here are all of the resources I used in creating this presentation, and please feel free to ask any questions if you have them.